Now we will talk about aortic regurgitation. In aortic regurgitation, the valves are not closed properly and the blood in the aorta will go back to the ventricles. That's why the apex beat will be displaced. What is apex beat? Apex beat is actually the thrust that is produced by the ventricles on the chest wall. And when the blood is get back to ventricles from the aorta, that's why the apex beat is displaced. What are the causes of aortic regurgitation? The rheumatic disease and the bicuspid aortic valve. These are the causes. Ehlers-Danlos syndrome, Marfan syndrome. Okay. Though, so the pulse is, what is the pulse? Pulse will be large volume pulse because and it is also called as water hammer pulse. Why it is called water hammer? Water hammer means the splash sound will be formed because when the valves will not close, they will get the push the blood back to the ventricles. That's why the splash sound will be formed. That is called the collapsing or water hammer pulse. And it is early diastolic murmur. How it is early diastolic? Because after the systole, the blood has been pumped into the aorta. Now the ventricles are getting filled during diastole. The aorta god, it will push the blood back to its ventricles at the stage of diastole, at the early stage of diastole. That's why it is called early diastolic murmur. The severe cases are Austin Flint murmur, that is, the aortic regurgitation will be heard at fifth intercostal space, right? Normally, the aortic regurgitation is heard at a left third intercostal space. It is also called Erb's point. But in severe cases, Austin Flint murmur, it will be heard at fifth intercostal space. I hope it is clear to you.